Hello, everybody. This is Mandeep Singh. I'm joining you from Toronto. I'm an associate professor at University of Toronto. I'm an anesthesiologist and sleep physician. And thank you to Eugene for giving me the opportunity to speak with you and share our experiences as we laid out the importance of recognizing optimal sleep health as it ties into our well-being. And thank you and congratulations to you all for this conference. I have no potential conflicts of interest. For this presentation, what we are going to learn is going to be recognizing what optimal sleep health means, how ties down to well-being of healthcare workers, and also what we can do to optimize it, and recognize what is dangerous sleepiness versus daytime fatigue. We are all trained as professionals, scholars, collaborators, communicators, but nobody talks of doctors as person. And thanks to Eugene and kudos to him to bring together this exciting conference to recognize this important aspect of ours. Physician burnout is not new for us, and you will be learning a lot about this during this conference. It's been tied into having medical errors, low professionalism, reduced patient satisfaction scores. But where does sleep health fall into this picture? So it's been conceptually defined as having different components like sleep duration, efficiency, quality, and sleep timing, which is circadian rhythm. But more importantly, also the daytime function and daytime alertness and sleepiness levels. We'll talk more about that subsequently. Importance to recognize intrinsic sleep disorders, sleep-related breathing disorders, sleep-related movement disorders, insomnia, as well as rare disorders like narcolepsy. And sleep health has been tied into affecting each and every organ system of our body, including morbidity and mortality. So how do we know if someone is having daytime fatigue versus daytime sleepiness? So here is this, night call team. They had a busy call. You see them, you're going to take the pagers from them and say, hey guys, how's it going? How's your call? And they look up at you. Now, which person, the staff is on the left, the resident is on the other side, who is sleepy and who is fatigued? So we can use questionnaires. Fatigue assessment questionnaire. You can actually use the QR code and do it yourself. It talks about mental fatigue, physical fatigue, and how we recognize it. But how do we know sleepiness? Epworth Sleepiness Scale is a validated scale. What it does is it basically have to give points whether how likely you are to be drowsy doing regular day-to-day activities. For example, this is a staff anesthesiologist who's also a critical care physician, very efficient, very competent, and on her off time, she likes to spend time with her friends and family, right? But when she's on her off time, she's now feeling sleepy. She's actually falling asleep, sitting and reading, watching TV on the computer screen after lunch. If given a chance to take a nap in the afternoon, she will do so very gladly. If she goes on a long drive for an hour, she's falling asleep. She's also falling asleep dangerously on the wheel and also in the middle of a conversation. These are red flags. This is what we will remember at the end of this talk. American Academy of Sleep Medicine, just before COVID, came out with this position statement. They recognize 50% of physicians mid-career were the higher risk of burnout, fatigue, and sleep deprivation. The reason? Shift work, high workload, sleep interruptions, and long hours. More importantly, we do not get enough recovery sleep. COVID came. We're talking about COVID as a condition, but we're also talking about how it affects us and my family, self-isolation, transmission, home confinement, redeployment on the background of what AASM was saying already just before COVID. What happens? Reports of sleep deprivation start coming out. First from China, nurses, women, people working, frontline workers in the Wuhan province were the first to recognize sleep was the first one to get affected, resulting in insomnia scores going high, depression, anxiety, and distress. At our institution, people came up in arms. We are not doing well. We are not sleeping well. Canadian level, same thing. The world over, same thing. What did we do? This is what Eugene has asked us. So at the Canadian Anesthesiology Society, from our wellness committee, we got together. We also reached out to our wellness leaders in psychiatry, and we came out with these recommendations. You can use the QR code to recognize that. There's an infographic that talks about what we do, regular day-to-day activities, how we recognize intrinsic sleep disorders, and how important it is for us to actually get it checked and treated for intrinsic sleep disorders. Another important aspect is recognizing we are dangerously sleepy, right? Drowsy driving has been associated with badness, not just for ourselves, but many people on the road. We don't want to do that. Emerge residents and staff, this study also indicated that there were the proportion of MVAs happening for them was directly proportional to the number of night shifts that they were doing. It's very important. Do not drive. How do we recognize situational sleepiness? You can use the Karolinska sleepiness scale. Use this. It's a 1 to 9 scale. If we are too sleepy, you're post call, you're going to drive home? No. You're probably going to take a recovery nap. When you feel better, you'll drive yourself, or you take a ride sharing app, or you take public transit, or someone else takes you home, right? Important, very, very important. How do we prepare ourselves for a night shift? So, on the day of the night shift, we want to see that we want to carry as minimal sleep debt as possible. Some people can also take a very short nap just prior to starting the night shift so that you have enough energy to do work on the night. During the night, at the first part of the night, you want to be as active, you have a high cognitive load, you want to perform, right? Light doses of caffeine you can take, but make sure that you're hydrated well and take some light snacks. When we are closing to the end of the shift, don't take any stimulants or caffeine because they're going to push us over off the cliff, right? And we don't want to be dangerously sleepy. Very important. In between shifts, recover. So take recovery naps, give yourself enough chance to recover, and then perform when we join back our duties. Very, very important. I hope you find it useful. There are some sleep health resources available in my presentation that I've shared with Eugene, and I hope that you will recognize find them useful. These are some digital tools for digital cognitive behavioral therapy for insomnia. And we are also wrapping up our RCT in for healthcare workers, and hopefully we'll be able to share the results pretty soon with you guys. These are some national resources and international resources for sleep as well. And I will stop at this and I'll be open for more questions about it. I know it's a very, very short, brief time to talk about sleep and how it ties down to wellness and having good outcomes for ourselves and for our patients. But open to your questions, and I really look forward to and congratulate all of you for this great conference that Eugene has brought together. Thank you, guys.